mini facelift is a smaller procedure than a full facelift. You know, it's a procedure that's most ideal for someone that's in their 40s, 50s, and sometimes even the 60s, where the main issues are really kind of a little bit of facial droop, kind of in their jowls, a little bit of droop in their upper neck, and when that's the case, you can just do a mini facelift, which will be able to lift that up, lift up the upper neck, lift up this jowl fat back up into the cheek, and that's pretty much all some of these patients need. The incisions are usually relatively small and very well hidden. The way that I do it is I put it, you know, the incision here starts around here and goes behind their tragus, so that this part of the incision is completely hidden. Goes behind under their earlobe and goes behind here. And so, because most of that path, as you can see, is pretty well hidden, you know, most of my patients can probably, you know, if they're women, wear their hair down and probably even go to the mall in about 2 to 3 days. The amount of bruising and swelling is not really significant, you know, if that's all they're doing. But having said that, most of my patients probably are doing a little bit more. You know, most of them are probably having their upper eyelids treated, their lower eyelids treated. And so that adds a little bit more to the time of the procedure as well as to their recovery, but not significant more time. Both, even if they're doing all three, I usually will give my patients a choice of whether they want to do it in the office or at the surgery center. The biggest difference between the two is at the surgery center there's an anesthesiologist to put you to sleep, and you don't remember anything from the time you begin to the time you end. There is a cost for that. You're paying the surgery center a certain amount of money, and some people don't want to be put to sleep. Alternatively, and I would say the vast majority of my patients have it done in the office. I would say probably 80–90% of my patients choose to have it in an office-based setting. If that is the choice, then it's done under what we call oral sedation. So you take a dose of Valium, Percocet, and that helps you relax. You're definitely not asleep. But most people are relaxed enough that they can go through a numbing process very similar to going to the dentist. They get dental blocks, and that numbs them up enough to do the work without having any discomfort. It's an option that is kind of nice because, you know, again, you're not paying for the facility fee, anesthesia facility fee. You are awake, and that makes your recovery that much easier.